The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Always Another Way podcast. My name is Marina Sprocki-Spriggs, and I'm your host. I have a master's in professional counseling, and I am the IPPY award-winning author of Stop Looking for a Husband, Find the Love of Your Life, and Nasty Divorce, A Kid's Eye View. I write positive divorce advice for the HuffPost, and I'm trained in clinical hypnosis. And this podcast speaks to out-of-the-box thinkers, and it's for those who hear the call of hope in always another way. And if you're very rigid and set in your beliefs, this is probably not your cup of tea. However, you should note, tastes can and do change. And I want to thank everybody who listens to Always Another Way podcast, whether you see us on Facebook Live, YouTube, SoundCloud, or listening on any one of the podcast apps. And just a reminder, wherever you are, if you subscribe and rate Always Another Way, then we begin to move up. More people can hear all these wonderful and life-changing guests that I'm having on the show. And Ozone Clinics in Dallas, Texas is our February sponsor. And I've been talking a lot about what ozone therapy has personally done for me, from kicking some sickness to the curb to exponentially increasing my energy. And ozone therapy is one of the most effective methods of whole body detoxification. Ozone therapy is used by doctors and sports teams across the globe to treat illness and injury. It's used to treat a variety of chronic diseases, including cardiovascular disease, diabetes, Lyme disease, chronic hepatitis, AIDS, herpes, chronic fatigue syndrome, and many more. You can supercharge your immune system and get back to feeling like your young self again with a session in one of their ozone saunas. They also offer insufflation packages, which are things that can also go in your ears. And I have personally done that to kick a cold to the curb in 2 sessions. So ohzoneclinics.com, and that is located in Dallas, Texas. And today we are going to be talking about the rhythmic language of health and disease and sound therapy with Dr. Mark Ryder. And Dr. Mark Ryder was a professor of sound therapy for 15 years, and he's been in private practice in Southlake, Colleyville, and Grapevine for over 25 years. He specializes in grief and trauma, individual and couples counseling, ADHD assessment, neurofeedback, biofeedback, medication, amino acid management, music therapy, and revisioning, which is peer-reviewed and is good for so many amazing things. So welcome to the show, Dr. Ryder.
Thank you.
Hi. So we're going to talk about a bunch of things, but you have written a book, and this was a while ago, called The Rhythmic Language of Health and Disease. Mm-hmm. And so tell us a little bit about that and about your sound therapy research.
Well, the Rhythmic Language of Health and Disease was the culmination of a project in which we were trying to show connections between the mind and the body, or between the brain and the body. And it was back in a time, back in the early 90s, when we were trying to find the mechanisms responsible for mind-body connection and how the mind can influence the body and so forth. So our study we used EEG to look at a lot of people who had immunological disorders like cancer and autoimmune disease, fibromyalgia, and found certain signatures that actually were sort of musical in a way. And when we looked at the EEG, basically we found that people who have illnesses, kind of chronic illnesses, get stuck in certain brainwave patterns, or just brainwave themselves, like alpha, getting stuck in alpha or getting stuck in theta. And so we were looking, we basically found that people who do experiences which shift the brain, shift the EEG, and will cause more health in the body, because we can get people unstuck from these kind of unhealthy brainwave patterns. So that's kind of it in a synopsis then.
I love that. So the brain is movable. You can
The brain is a symphony, and we need to kind of mind all the different parts of it. So.
Yes, changing it up. So tell us, when people talk about like sound therapy, sound healing, music therapy, what does that all kind of entail and the differences of those? Yeah.
Well, sound therapy is very interesting because it is more of a passive experience to sound, and we can talk about some of the things that people do, but like singing bowls and tuning forks and some of those things. There's more of a passive element, like receiving a massage, whereas psychotherapy would be something, or music therapy, like when you're doing a drum circle or an improvisational singing group. There's more participatory elements to it.
Very nice.
And that brings up different brain dynamics. So.
Okay, so what kind of dynamics do you think, or what is kind of the research show for some of those things? And you can talk about either one or both of them.
Well, I'll start with the topic I know the least, which is sound therapy. But I've got several friends who've written books on sound therapy. Don Campbell wrote the Mozart Effect a long time ago, and Jonathan Goldman wrote a book on sound therapy. And so they both came out of the music therapy tradition, but really were exploring the kind of types of vibrations and acoustics that different types of music has. But some of the research now is really interesting because it's showing that there's doing ultrasound experiments, for example, on microtubules, which are little proteins within the neuron. And they're finding that they can actually change the stem cells within these microtubules by just using ultrasound vibration.
That's pretty amazing.
So the patient doesn't really have to be involved in that experience, and there's very little research on it. But there is, I think it's really coming. They're looking at some experiments right now to see if they can improve Alzheimer's disease by changing the brain with ultrasound.
That's nice. And so since you were a professor of music for a long time, music therapy, what is the thing that you, I guess, noticed the most or the most beneficial for people, or what you liked the most about that and saw?
Well, the participatory element was really what I enjoyed most about music, because anybody who, of course, all music therapists, all musicians grow up using music on themselves first. Yeah. Because we use it in therapeutic ways, not specifically designed by a therapist, but we all thought that it helped us in some way. Maybe self-esteem if we learned how to play an instrument, maybe with emotional expression if we learned how to express feelings to music, movement because it involves a lot of physical exercise, and then discipline. So. Yeah, and then I began to research a lot of these elements when I was at teaching at Montana State and also at SMU in Dallas, and finding out that the body is affected quite deeply by music and the participation in music. These go and kind of things go into like, well, imitation is like one of the only features of the brain that is inherited.
Oh, really?
The ability to imitate. So that is the formation of all language, of course, music and motor behavior, so sports and everything else, communication. And so music therapy kind of started by taking a room full of, we used to call them, developmental disabled kids who had motor impairments, speech impairments, and mental impairments as well. And when you start to play music, it stimulates the thalamus. And the thalamus is the kind of the sensory motor integrator in the brain. And so immediately we start to feel like we want to dance or move if we're hearing a beat.
Yeah.
And so we noticed this is back in the post-World War II, around the 40s and 50s, that, a lot of these kids didn't have services, but there were more services needed because a lot of the parents had died or become disabled because of World War II. And so England was another country that used quite a bit of music in post-World War II. So they began to find, interestingly, that when they would imitate some of the behaviors that these kids have, because they might not have full speech, but they would have echolalia, they would have motor perseverative behaviors, spinning and so forth. And if you match the music to those behaviors, that suddenly the kid would like tune in and they'd start to learn language, they'd start to learn behaviors. And so it was so cool to be able to create this communication response.
That's amazing.
Just by imitating them.
Yeah, that's really, really cool. And I did see, this is like a side note, there's a video going around somewhere of, and maybe it was Parkinson's people, but when they would sing, and it was like songs from like their youth that they knew, like Old MacDonald, the tremors slowed down and were able to sing just that sing-songy Old MacDonald, you know, exactly like that, just live. That's super cool.
Yeah, and even different types of music, like stimulative music does affect more beneficially Parkinson's and other motor disorders like cerebral palsy, whereas maybe for anxiety reduction or sleep, you know, we might use sedative music or a calming music for that.
Very cool. And so, so tell me like a little bit more about like your experiences with it and what you've seen and done. And you just touched a little bit on that, but just, or just more research that, you know, anything else kind of interesting that goes that way.
Well, part of the research that I spearheaded at SMU involved creating a new type of music that wasn't around. Because we knew that by imitating behavior, by imitating mood, and there's a psychiatrist that used to sit on his piano in the back of the room while the client was maybe laying down on the couch, and he would just play music that matched the patient's mood.
Nice.
But then he found if he wanted to get them out of depression, he would start with depression music, and then he would kind of start to improvise in a more of a lullaby or kind of a more stimulative fashion. And so he began to have a curative effect if you go into his private practice and you might be depressed and you come out being happy, because he would be able to kind of pull that depression into happier music. And we call that pulling entrainment.
Entrainment, nice.
And so I was one of the first to develop the concept of entrainment with music. And so we developed an improvisatory technique whereby we would match the imagery that patients had. It might be imagery of depression or happiness and things like that. And we did a lot of studies on medicine with imagery, again, the mind-body imagery of what we call medical imagery, to help the mind heal the body of autoimmune disease, cancer, and a lot of other different illnesses, like a lot of pain disorders. So this music would start, and for a couple of minutes it would match this pain music, or match the client's imagery of their pain. So it might be cacophonous, a little loud and grating, and then after a couple of minutes the patient's ready to kind of, you know, turn it off. And so then we start to shift our music, and then for about the next 8 minutes or so the music shifts into a more calming lullaby kind of music, which matches the images that the patient described of their immune system. Sometimes they're pretty vague. I don't have really any image of my immune system. Yeah, the doctor showed me these radiological images of my cancer, so I know what it looks like and all that, but I have no image of what my immune system is. So we educate them about the immune system. We have different instruments that will register like a finger symbol that will register an immunoglobulin coming out of the hypothalamus or something. So all these elements are embedded in the music that we're playing, and so the patient gets this marvelous experience that A, it's made for them, and secondly, it has a curative effect, because then their physical response to the new imagery, which is now healthy imagery, is that they have much better management of their pain, their disease, and so forth.
That's awesome. And so it does. So are the people, are their eyes closed while they're doing this, open, or?
Well, we'll use several patients, in fact, to play the music instruments along maybe with one music therapist. And then the patient that's being focused on will be laying in the middle. And so we're kind of in a horseshoe around them. So
that's nice. And then how long does it take? So if somebody were coming in and they have, you know, something autoimmune, cancer, whatever, and are like, okay, I want to use this as an, you know, something else to add to my healing.
It can work really, really well in about 10 minutes.
Nice.
In fact, most of our improvisational pieces are about 10 minutes that we've recorded.
Very, very
I've got
cool.
a sampling of one on my website, drmarkreiter.com. Not the whole thing's not on there. It just kind of gives a little snippet of the beginning, a couple of in the middle, and at the end, kind of how the music progresses and changes.
Nice.
So.
And then you mentioned something too about noise pollution, sound pollution.
Well, if you're investigating sound, you have to be aware of sound pollution. So, yeah, and sound pollution is really becomes a factor when you're listening to something chronically maybe several hours a day, it's over 50 decibels.
Okay.
So if you've been, so traffic or loud concerts can go up to above 100 decibels. You know, the kind of thing where you just are,
Oh, I
feel
know.
it, not just in your ears, but you feel it in your whole body.
Yeah.
But so you
Into
50
some drum and bass like that.
yeah, so 50 is not all that high, but you know, so if it's going on for a significant period of time, it can cause not only ringing in the ears, which we all know from the 60s if we've been to rock concerts, but it can cause hypertension. It causes sleep problems, stress-related problems, increased cortisol, and a lot of negative health problems.
Ooh. Yeah,
So.
stay away from that. Or do earplugs help? I'm wondering.
Earplugs do help, and which is what a lot of people, and they have noise-canceling earplugs that a lot of people at the airports and so forth will use to try to help with that.
Very nice. So let's see. What else do you think about just, benefits or anything else maybe just that
Well,
we
some of
didn't
the,
talk about?
the
Yeah.
really cool things that a lot of people maybe have been lucky enough to participate in, sometimes at their churches or other places where there's singing, not just singing, but improvisational singing that we call toning, and also drum circles. I'd like to say a little bit about that.
Yeah, let's talk about all
Because
this.
they're so fun that you just can't, when you hear a drum circle going on, you just can't help but, be attracted to it and want to participate.
Yeah, tell us about that. I love drums.
So, well, drum circles do nothing less than boost the immune system, turn off inflammatory chemicals in the brain, increase oxytocin, which is the connecting chemical in the brain, and just a lot of other things. I mean, reduce cortisol, and so forth. So, but the neat part is that they're able to, just doing a drum circle is even boost your immune system.
So what does that look like if somebody said, okay, I want to go to a drum circle? What does that entail? You show up and what happens?
Well, a lot of drum circles are just kind of the less controlled or supervised drum circles will just be kind of people just drumming for maybe. I've done some of those where they'll have maybe 15-minute sessions, but then you'll have another session, and basically they can sound fairly similar, and you're just kind of like exercising as you're beating the drum. But so there's not a lot of differentiation sometimes. When they're supervised, and they're real cool because there's like call and response. And so you may be led on to call and respond with your own rhythm, and then it goes around to the next person, and then she does her call, and then the rest of us respond.
Oh.
And so it can go around the room, and then we all come back every now and then to one big cacophonous, but in tune. I mean, rhythmic acceleration of all our drums and everything. So those are really exceptional experiences.
And a nice way to just get a little bit of healing in, but fun
Yeah,
too.
yeah.
And fun. Okay, now what about the
toning groups? I used to lead when I was at SMU, and they're pretty unusual because it's based on the idea that when you're, we had done some experiments with people hooked up to EEG, and we found that when they would tone, which is when you're just kind of exploring your vocal pathway, kind of like a siren from a low sound slowly up to a higher tone. Back down to a slow one, you'll kind of find a frequency or a pitch that seems to resonate in some way with what's going on. Sometimes you may have pain, and that you might find a frequency that kind of causes that pain to kind of resonate a little bit, but then if you keep toning on that frequency, the pain will go away.
Nice.
And so we would also find with the EEG that it would reduce ADD, that people, if people who are listening out there, if they want to help with ADD in the morning, either in the shower or on your way to work or school, to just kind of do some random vocalizing. So you kind of go up and down, you kind of find a pitch, and you just stay on the pitch until your breath until your breath goes away.
So you just start
low,
and
then
go,
you start back again, and but you usually just stay on this same pitch, just and just keep going. And there's overtone chanters who can really get the overtones going, and
wow,
we have a lot of suspicion that does something healing as well, because it may activate the higher frequencies you see in overtone chanting, and other instruments like the gong and so forth will tap into the vagus nerve, which is just above the ear actually, and it responsible for the parasympathetic relaxation response.
Very nice.
So
yeah.
I think our research and what we know about this stuff is really in its infancy. And but you know, it'd be really exciting to be around 100 years, 1,000 years to see what is able to be done with this in that amount of time. So
yeah, just from since when you've been in there, just all these different things, and then you've done like the research with EEG and other things that can just show you like, okay, this really works. And then I'm too of the believer that if you don't have access to that, that you know in your body.
Yeah.
Do you know what works? You can also do a blood test or other things if you have, you know, if you have issues to figure that out.
Oh, we've collected all the variables, blood, sweat, and tears.
Yeah. And what else, so, did we not talk about that you think is just important for people to know about music therapy, about sound, about all of this?
Well, learning an instrument is almost as critical as learning a foreign language. In fact, learning an instrument at an early age does help with learning a foreign language. So we know that there's a lot of cognitive development. The Mozart effect has shown that music that is somewhat structured similarly to that, music, classical music would be the period, seems to help with learning. And so there's, you know, so picking up an instrument to just help learn, it causes, you can create neuroplasticity in your brain within 5 minutes just learning a new chord.
Nice.
And so that kind of then teaches you about other neuroplasticity because you just kind of chain that along to other types of things you're learning. But then when you're good enough to just play by yourself, then you can almost become ready to start playing with somebody else. And that is where you get all the magic happening, because oxytocin, in our studies, we've been able to find that we can light up the brain's mirror neuron system, which is the connecting and empathy part of the brain. And then we can light that part of the brain up. We'll do improvisations and have people hooked up to EEG. And when they get in the zone, their EEGs start to match. Wow. And they become highly correlated together. So that's responsible for being able possibly to even communicate at a distance with each other. With the mother, when the proverbial mother, when she feels her daughter's pain thousands of miles away, she can tap into it.
Yeah, that's super cool.
So the biofield is something we hear about in sound therapy that maybe extends about 5 feet outside of our bodies and includes, you know, basically just that, a non-tangible type of energy field that, you know, that a lot of therapies tap into, like Reiki and the biofield tuning, which is where they use tuning forks. And so, but this suggests that, you know, the biofield may extend even, you know, thousands of miles if we can, you know, tap into that level. So, but connecting with music instruments is just about as good as sex, and that's
well, there you go.
Yeah,
that's an excuse.
And it's just
get the drums.
It's so fun. Yeah,
yeah, very, very nice. And so I guess you know, are there anything else maybe before we kind of wrap up that we need to know about this, and then we'll tell everybody where they can find you too.
Yeah, so the going back, I don't think I finished the toning thing. So basically you would tone for about 5 to 10 minutes. Okay. Now what we do in groups is so much more fun, because when you're just toning by yourself, you're just kind of tickling and kind of moving around that tone that kind of tickles or kind of stimulates parts of your body that may seem to need kind of tuning at that moment.
Right.
But you do it for about 5 to 10 minutes. But when we do it in groups, we actually have we have the whole group. I've done it in groups larger than maybe 150. And so we're all laying down in an auditorium on our backs, and then we just turn all the lights off, and then we start to tone. And so it's so cool because everybody will start to communicate one by one in the group, you know, with different types of sound, like laughter and chuckling and animal sounds and different things. But then after about 15, 20 minutes, everybody settles down into this just a chord. You know, first it's kind of an ohm, but then it'll have chord features where everybody's contributing different harmonics to the chord. And boy, I tell you, that's stimulating.
Wow, very, very neat.
That is extremely stimulating. So.
Very, very cool. So many, many reasons to just hook up to some sound, any sound, playing music, playing with others.
Yeah.
And then... and
oxytocin also stimulates the immune system, so you're actually healing the body and the heart, which is the emotional part, when you turn on that oxytocin by connecting. So.
Well, there you go. I mean, what other reason do you need aside from that?
I don't need any others.
To get some sound. Yeah. And if you, and Dr. Ryder was on one of my earliest shows to talk about another thing that he does called revisioning. And then we'll just talk like high level briefly about that. And then you can go back, I think it's episode 14. It's just a groundbreaking. He's got a book on it. It's peer reviewed. But just briefly tell everybody about your revisioning that you do.
Well, revisioning is the use of a mirror to simulate reattachment of a lost loved one in grief. And this is, it was completely borrowed from Ramachandran's technique of mirror therapy for phantom limb pain in amputees and stroke victims. So I started doing, inevitably you get somebody that comes in who has a stroke or, an amputation. And so I was doing a little bit of that work because I'd read about it and found that you just had a brain idea one day that this might really be good to help with complicated grief, because people would come in with anxiety and depression. You could help that with different therapies, medication, but then they still couldn't look at a picture of their lost loved one without having significant distress. They couldn't even talk about the person. So when you set this up in a mirror, which is, I'm going to explain this pretty briefly, then it, as if you're doing mirror therapy, so basically you would be my lost loved one. You'd be your picture in a prop that would be sitting next to me, and then the mirror would be there. And so when I'm looking in the mirror, I'm seeing as if you were still next to me, even though I know it's your picture, not your real person. But that's enough to, that trick or that illusion in the brain is enough to really cure complicated grief.
I know, and I've seen that live. And then if you get back on that episode, I'm going to put this all in the show notes. You can hear the whole story about revisioning, and works for more than just complex grief too.
Can I mention one last thing?
Yeah, absolutely.
Well, since then, we have started to use music as the mirror.
What?
Yeah,
Tell us about that. We got time.
So I've started working with some clients that I've got some videotapes on, in which instead of using a mirror to hold their picture up, because we use it when we look at trauma and DID and personality disorder and things like that, depression, we'll do drawings instead of photographs.
Yes.
And so, but the person doesn't have to hold the drawing up to the mirror.
Yeah.
We can simply have them close their eyes, and then I can be in the background making music. So I'm sitting there with two different music instruments, making music that kind of matches where they need to go in their integration work.
Nice.
And so we've had some clients that have responded just as well to that as they did to the regular using the mirror. So
really, really cool.
Yeah.
And then what a neat experience, and drug-free. I mean, so there you go. Side effect, nothing but good.
Yeah.
Super cool. I really like that. And so for all of you listening, you can go to Dr. Mark Ryder. It's MarkRider.com to find out more about Dr. Ryder and everything that he does. And then I'll also have the link to the episode on revisioning so you can learn more about that. And I want to thank you so much for spending your time. And if you see a local sound class where you are, go check one out. If you are thinking about picking up an instrument, we just gave you a whole bunch of good reasons to do that, and then join a friend. So thank you all for listening, and you know that there is always another way.